Hello everyone. Today we'll be talking about complications of otitis media. So otitis media complications are divided into intratemporal and intracranial. There's some classifications that divide it into intracranial and extracranial as well. So let's look at the intratemporal complication. This basically refers to the complication that arise within the confines of the temporal bone. So the first complication is mastoiditis. So basically mastoiditis refers to inflammation of the mucosal lining of the antrum and mastoid air cell system. Okay, so that's what we refer to as mastoiditis. So what are the clinical features? What are the symptoms that you're going to notice in mastoiditis? So basically the symptoms are similar to that of acute separative otitis media. So they're going to present with pain behind the ear, fever, ear discharge. And when you go to the signs, you're going to notice mastoid tenderness, ear discharge, sagging of posterior superior meatal wall, perforation of tympanic membrane, swelling over the mastoid, hearing loss, and some other general findings such as the patient will appear ill and toxic with low-grade fever. The next complication that we're going to look at is petrositis. So what is petrositis? Petrositis basically refers to a condition whereby the spread of infection from the middle ear and mastoid to the petrous part of temporal bone. So that's what we refer to as petrositis. So what are the clinical features? The clinical features comprise of Gradienigo syndrome. So this is basically the classical presentation, and it consists of a triad of external rectus palsy, which is the sixth nerve palsy, deep-seated ear or retroorbital pain, which is due to the fifth nerve involvement and persistent ear discharge. However, nowadays it's rare to see the full triad. Then we go to the third complication, which is facial paralysis. So this can occur both as a complication of acute and chronic otitis media. Then we get to labyrinthitis. So what are the clinical features that you're going to notice in labyrinthitis? So this is whereby a part of the membranous labyrinth is exposed and it becomes sensitive to pressure changes. So patient is going to complain of transient vertigo, often induced by pressure on the tragus, cleaning the ear or while performing Valsalva maneuver. And it's diagnosed by the fistula test, which can be performed in two ways. So basically, you can apply pressure on the tragus or using the Siegel speculum. Then let's go to the intracranial complications. So the first intracranial complication is extradural abscess, which is basically a collection of pus between the bone and dura. It may occur both in acute and chronic infection of the middle ear. So the clinical features consist of persistent headache on the side of otitis media, severe pain in the ear, general malaise with low-grade fever, pulsatile purulent ear discharge, disappearance of headache with free flow of pus from the ear. Then we go to subdural abscess. So subdural abscess basically refers to collection of pus between the dura and the arachnoid. Clinical features consist of meningeal irritation, which is presented as headache, fever, malaise, increasing drowsiness, neck rigidity, and positive clinic sign. Then you may notice raised intracranial tension, which presents with papilla edema, ptosis, and dilated pupil. Then cortical venous thrombophlebitis, which is basically veins over the cerebral hemisphere undergo thrombophlebitis, leading to aphasia, hemiplegia, and hemianopia. The third complication is meningitis. Meningitis basically refers to inflammation of the leptomeninges, the pia and arachnoid, usually with bacterial invasion of CSF in subarachnoid space. And it's the most common intracranial complication of otitis media, and it can occur in both acute and chronic otitis media. Then we go to the fifth complication, which is lateral sinus thrombophlebitis. Sorry, the fourth complication, which is brain abscess. So one thing you need to know is 50% of brain abscesses in adults and 25% in children are autogenic in origin. And another thing you need to take note is in adults, abscess usually follows chronic suppurative otitis media with cholesteatoma, while in children it's usually the result of acute otitis media. So the clinical features that you're going to notice is one thing you need to know as well is brain abscess is often associated with other complications such as extradural abscess, perisinus abscess, meningitis, sinus thrombosis, and labyrinthitis, and thus the clinical picture may be overlapping. Clinical features can thus be divided into those that arise due to raised intracranial tension and those due to the area of the brain affected. These are the localizing features. So, the symptoms and signs of raised intracranial tension include headache, nausea and vomiting, the level of consciousness, papilloedema, slow pulse, and subnormal temperature. Then, the localizing features include temporal lobe abscess. You're going to notice nominal aphasia, homonymous hemianopia, contralateral motor paralysis, epileptic fits. Then, if there is a cerebral abscess, you'll notice headache, spontaneous nystagmus, ipsilateral hypotonia and weakness, ipsilateral ataxia, dysdiadochokinesia. Let's now move to the fifth complication, which is lateral sinus thrombophlebitis. So basically, this occurs as a complication of acute coalescent mastoiditis, mass mastoiditis, or chronic suppuration of medial ear and cholesteatoma. The clinical features include there may be a fever with rigors, headache, progressive anemia, and emaciation. There may be the presence of Gressinger's sign, which is due to thrombosis of mastoid emissary vein, and edema appears over the posterior part of the mastoid. Then you may notice papilloedema. Then there will be tenderness along the jugular vein. Then let's look at the sixth and last complication, which is otitic hydrocephalus. So this is basically characterized by raised intracranial pressure with normal CSF finding, and it is seen in children and adolescents with acute or chronic middle ear infection. So the clinical features include severe headache, sometimes intermittent, is the presenting feature. It may be accompanied by nausea and vomiting, diplopia due to paralysis of sixth cranial nerve, blurring of vision due to papilloedema or optic atrophy. The signs include papilloedema, which may be 5 to 6 diopters, sometimes with patches of exudates and hemorrhages. Nystagmus due to raised intracranial tension, and in lumbar puncture, CSF pressure exceeds 300 millimeters of water. So that's all about the complications of otitis media. So this is basically a diagram showing the cerebral abscess, labyrinthitis, facial paralysis due to the nerve involvement, Mastoiditis, lateral sinus thrombosis, extradural abscess, cerebellar abscess, meningitis. Then let's talk about the sequelae of otitis media. So these are basically the direct result of medial ear infection and should be differentiated from complications. And these include perforation of the tympanic membrane, ossicular erosion, atelectasis and adhesive otitis media, tympanosclerosis, cholesteatoma formation, conductive hearing loss due to ossicular erosion or fixation, sensory neural hearing loss, speech impairment, learning disabilities. And the last two are secondary to loss of hearing in the developmental phase of the infant or child. So basically, this is all about complications of otitis media and the sequelae. Thank you.